One of the most common conditions I see in my practice every single day for the last 25 years is low back pain. I am Dr. Melissa Lockhart. I live in the state of Washington and I practice here too. And I'm here to talk to you about low back pain and what you can do about it. One of the most common reasons for low back pain, barring things like lumbar discs and injuries and things like that, assuming that stuff has been ruled out. And actually, in some cases, what I'm going to tell you today is good for those things too. But one of the most common things that I see with chronic low back pain that isn't like acute injury related is lumbar instability. So what that means is have a patient come to my office. They have chronic low back pain. Usually it's right along here, right above sort of the glutes and the low part of the lumbar spine. And that's where they hurt sort of all the time. And when we feel the muscles, they're really, really tight. And what my patients say to me, and this is a red flag for me, is I stretch and I stretch and I stretch because it's so tight. And when I stretch, I can really feel it, but that really doesn't get rid of it. It comes right back and I just always have this pain. Those people often have what's called lumbar instability. And what that means is the muscles that line the vertebrae in the low back, in the lumbar spine, that are supposed to be holding those spinal joints stable are actually weak. And they're really difficult muscles to keep strong. What the body does with that when there's weakness there is it creates extra tone in the muscles that line the spine this way, the paraspinals, and those get really, really super tight as a way of stabilizing the low back. So the solution is not so much to stretch the lumbar paraspinals that are now over tight, but to strengthen those stabilizers that are supposed to have a little bit of tone. So the exercises I'm going to show you today are going to do just that. And you can do these at home. You don't even need a gym. Okay, so I'm going to show you 2 different exercises for low back pain that require lying on the floor. I'm just here on my carpet. A yoga mat works too, whatever you're comfortable on. The first one is going to be a plank. Now, I know everybody knows what a plank is, or at least a lot of people do. Let me just clarify, there are many ways to do a plank. None of them are wrong. The plank I'm going to teach you today is specifically for low back pain caused by lumbar instability. So if you are watching today and trying to learn an exercise to help you with your low back pain, best if you do the plank just the way I teach it to you. So a plank is lying face down. Okay, this plank will be done on your elbows, not your wrists. Elbows are right underneath my shoulders. Hands are comfortable. Feet are together. That's important. Feet are together. You come up in a plank. Right now I am parallel to the floor, but I want you to watch what I do with my upper back. Upper back, just the upper back, gets pushed up toward the ceiling. Not the hips, those stay down here. The upper back gets pushed up towards the ceiling. This is the plank I want you to do. If your upper back is down here, you're recruiting your shoulders and your arms to hold the plank. And we really just want to isolate those core muscles that surround the lumbar spine. So this is your plank, looks just like this. You're going to hold this plank until you're shaky and tired, because once you're shaking, you're going to start recruiting other muscles to hold the plank. So you really only want to hold it for as long as it's being held correctly. And for me, I'm just starting to tremble, so I'm going to break. So you do your plank, you hold it till you're shaking, and now we're going to rest. That's 1. We're actually going to do 3 of these. I usually rest around 10 to 15 seconds. You can rest longer. It really doesn't matter. 3 planks is important. You really do want to fatigue those muscles. That's how you build muscle. So I'm going to come up in that same plank again. I always start parallel to the floor. And then I push my low back or my upper back up toward the ceiling like this, and I hold it. And don't forget to breathe. One more note about this plank. Try not to hang your neck down here. Try to keep your neck in neutral. We don't want to create neck strain by doing an exercise that's good for our low back. So I'm going to go ahead and rest. Each plank is going to get a little shorter because, like I am, you're going to get tired, and that's okay. After about 10 or 15 seconds rest, longer if you need it, we'll do a 3rd plank. Feet together, come up parallel to the floor, push the upper back to the ceiling, and hold it till you're shaky. Some people can't hold this more than about 3 to 5 seconds. That's fine. 3 to 5 seconds, 3 different times is better than nothing. And over time, your plank will get easier and you'll be able to hold it longer. So most people do these planks twice a day, 3 in the morning, 3 in the evening. That's pretty important to have that repetition. And right around the 2 to 3 week mark is when they start to feel like their low back pain is alleviating. So if you start doing these planks twice a day, 3 times each, and it's been a few days and you're not noticing anything yet, just hang in there. Couple 3 weeks is about how long it takes to build enough muscle tone in the muscles around the lumbar spine to actually stabilize and make you feel better. And that's the plank. We're going to move on to a second exercise. So this is the starting position for exercise number 2 for chronic low back pain. This is going to be called a side bridge. Here's what I want you to notice. My knees are bent at 90 degrees. My legs are not like this. My legs are not like this. I want my knees at a 90-degree angle. You want your elbow right underneath your shoulder. I like mine tucked in pretty far. I have some labral tear issues in my shoulder. So if I'm out here, I get a little sore. So I like my shoulder right under here. And then my hand is resting on my hip. And then the other important thing is the knee, the hip, and the shoulder need to be in a line. If you do your side bridge like this, you're doing it wrong. We straighten this into a line. The side bridge exercise looks like this. Come straight up. All the action is happening right here in this QL muscle and these obliques. My knee, my hip, and my shoulder are in a straight line. And I'm not using this leg to hold myself up. This leg is totally resting on the other leg. And I'll feel the muscle that I'm working, and where I'm going to feel the muscle getting tired is right here. That's what you should feel when you do the side bridge. So similar to the plank, you're going to hold the side bridge till you're shaky and tired. And be careful that you're not leaning back on your side bridge and you're not tilting forward on your side bridge. Those are all ways to cheat. You just want to be straight perpendicular to the floor. You hold that till you get tired and shaky, and then you rest. And much like the plank, we're going to do 3 of these. I like a long rest on this one because it wears out my shoulder, being that I have a shoulder injury. I can still do it. Second side bridge, here we go. Come up. Make sure I'm not cheating with this upper leg. Make sure I'm feeling all the activity right here in this oblique. One of the things research has shown that for people with chronic low back problems, especially if it's sacroiliac, which is one of these joints in the low back on the right and left, oftentimes they have a weak quadratus lumborum muscle, QL, and that is the muscle, one of the muscles we are working right now to take the pressure off that SI joint. So that's 2 side bridges. We're going to do a third. Last one, it'll be my shortest because I'm getting tired. And that is how you do a side bridge. Then, of course, we're going to flip to the other side. Now, I don't care if you only have low back pain on the right or only on the left. You always exercise both sides. Same with stretching. So we'll switch over to the opposite side. Same exact thing. Knees are at 90 degrees. Knee, hip, and shoulder in a straight line. My elbow's tucked in a bit. And I come on up. Try not to use this upper leg to help. And I hold it till I'm shaking. Now, I have an old, very chronic left SI problem from way back. It started probably 30 years ago for me. I hardly ever notice it anymore because I'm pretty strong. But what I do notice to this day, my left QL is weaker than my right QL. And that's typical for a sacroiliac problem. So chances are on this side, I'm going to hold it for a little less time because I'm going to fatigue faster, and that's okay. So there's one. We'll do number 2 after a short rest. I'm going to bring my shoulder in slightly to make it a little more comfortable. And then here's side bridge number 2. You really want to make sure you're feeling it in the target area, which is right here. If you're feeling it somewhere else, you might want to recheck your positioning. Make sure you're not doing this slightly incorrectly somehow. And then the third side bridge. Just like that. And as I said, this is my weak side, so I'm pretty fatigued, so I'm going to call that good. Those are 2 low back exercises to help you with your chronic low back pain. There are some patients in my office that have a really hard time because of their condition or because of their low back pain being a little bit on the acute side, that have a hard time getting down on the floor and back up off the floor. There is an exercise that's a little bit easier. It's more foundational for those patients. So if you're one of those people that looks at this exercise and thinks, I can't do that, that's going to hurt, getting up and down off the floor, then I have a different exercise for you. It's going to be against a wall. It's very simple to do. Doesn't cause any pain, even if you are in an acute low back pain situation. We'll do that one next. I'll show you this one. So a great exercise, if you are not a person who can get up and down off the floor to do the exercises shown previously, the wall squat is a much better fit for you. And here's how this works. Find a wall, nothing on it. Lean against that wall. My feet are pretty far away from me at this point. They're about shoulder width apart, and I want to say they're a couple, 18 inches or so away from the wall. And I'm going to need to be far away from the wall in order to allow for this knee bend I'm going to show you. But the first part of the wall squat is to flatten your low back against the wall. So I'm going to tilt my hips up a little bit just like this. Right now my lumbar vertebrae are touching my wall. I cannot fit a hand between me and those vertebrae. It is flat. By doing this, I'm creating a core contraction, and that's part of this exercise. I'm going to hold that, and then I'm going to relax my upper body. And while my back is flat, I'm going to slowly slide down, bend at the knee. We never want to bend the knee past the heel or the ankle. That is why my feet are so far from the wall right now, because once we get to this point, we want to stop so we don't strain the knees. My back is still flat this whole time. Now that I'm at the bottom of the exercise, we're going to add a glute squeeze. You're going to squeeze your butt cheeks, basically. Pretend there's a quarter between them. You're going to squeeze, 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 squeeze. Hold that squeeze while you stand back up. That was one wall squat. I'm going to do that again. Flatten the low back against the wall. Slowly slide down, not past about this point. Add a glute squeeze in, and while you're squeezing, push up through the legs. That was 2 wall squats. I'm going to keep doing these. I have my patients do 5 to 10 wall squats, once in the morning, once at night. 5 if you're very weak, and that's plenty for you and you get super tired. 10 if you have a little more strength, and you can go to 10. Add a glute squeeze, push up, start over. Flatten that low back against the wall, create that good core contraction, slide down to about here, add a glute squeeze, push back up while you're squeezing. That was what, 4 or 5? I've lost count. So 5 to 10 wall squats, once in the morning, once in the evening. This is a great introductory exercise for chronic low back pain sufferers who aren't quite strong enough or in condition enough to get on the floor and do planks and side bridges. So if that's you, you can start with these. When you start feeling better and you're ready to get on and off the floor, then it's time to move to those other exercises, which are just a touch more difficult.